Chronic acid reflux is something that many Americans face. It can be uncomfortable to deal with, but it's not a big issue, right? Wrong.
Heartburn is not harmless.
People with acid reflux can develop a condition called Barrett's esophagus.
The lining of the esophagus can change from one type lining, which is like your skin, which is called squamous epithelium, to a lining that looks more like a piece of intestine. This intestinalization, this replacement of the normal squamous epithelium, the normal lining of the esophagus, begins to occur. And over time, it may extend up a certain percentage of the esophagus.
So who is at risk of getting Barrett's esophagus?
If you're a white male over 50, you're a smoker or former smoker, you have a family history, you have central obesity, you're at risk. You should talk to your doctor about it. Heartburn used to be something that was required by the guidelines, but we know now that you don't have to have heartburn before you ask your doctor about Barrett's esophagus. But a large percentage of people who have Barrett's esophagus will have had reflux in the past, and sometimes it sort of goes away as this new lining grows in, or they're still having acid reflux. They'll tell you they lie down and they have acid coming up. They wake up in the middle of the night with that. They're taking Tums or Rolaids, antacids. If they're taking a lot of that stuff, that's very, very worrisome.
People with Barrett's esophagus are at a higher risk of getting esophageal cancer. But if you have Barrett's esophagus, there's good news.
Most people out there with Barrett's esophagus can be monitored, and most are not going to develop cancer.
In patients with Barrett's, cell mutations in the esophagus can build up. That's called dysplasia. With low-grade dysplasia, cells are just starting to look a little strange. But with high-grade dysplasia?
High-grade is right on the fence of cancer. Certainly when you develop high-grade dysplasia, you're going to have to seek out an expert in Barrett's esophagus. Like our team at Cooper, we could take somebody from the brink of cancer with 4 inches of Barrett's esophagus, put their esophagus completely back to normal with a few outpatient procedures.
And if a small cancer is detected during monitoring, the team at Cooper can handle it.
They're basically cured with an outpatient endoscopic procedure. We have removed hundreds of cancers from patients and their early stage lesions.
If you're at risk for Barrett's esophagus, come to Cooper.
This is the only way we're going to find that patient, diagnose them with Barrett's, and prevent them from getting esophageal cancer. If you're diagnosed with Barrett's esophagus and you're put into a surveillance program, you're not going to get esophageal cancer.
Cooper has a team of world-renowned experts in Barrett's esophagus who use cutting-edge treatments and technologies to protect patients' health.
We're specially trained to look for things that a lot of people might not see. When they come to us, they're going to get a comprehensive evaluation. They know they're going to be getting the best care, the most meticulous upper endoscopies, and state-of-the-art evaluation and treatment of their Barrett's esophagus. Extraordinary happens here.